Hello and welcome. Today we're diving into a relatively rare but important topic, bladder leiomyoma. We'll explore what this condition is, its potential causes, how it affects the body, and what can be done about it. So, let's get started on understanding bladder leiomyoma. The exact cause of bladder leiomyomas remains somewhat of a mystery. However, research suggests that several factors may play a role. These include genetic predispositions, hormonal influences, particularly estrogen, and chronic irritation or inflammation of the bladder wall. It's also worth noting that leiomyomas, in general, are tumors of smooth muscle tissue, and their development can be complex and multifactorial. While we can't pinpoint a single definitive cause, these factors are thought to contribute to their formation. Let's delve into the pathophysiology. Bladder leiomyomas are benign tumors arising from the smooth muscle cells within the bladder wall. As the tumor grows, it can compress the bladder, reduce its capacity, and obstruct the flow of urine. This obstruction can lead to symptoms related to urinary frequency, urgency, and difficulty voiding. The location and size of the leiomyoma will significantly impact its effects on bladder function. Ultimately, the tumor disrupts the normal physiological processes of bladder storage and emptying. Bladder leiomyomas are considered rare, accounting for less than 0.5% of all bladder tumors. They are more commonly found in women than in men, typically between the ages of 30 and 50. However, it's important to remember that these are relatively rare tumors, and comprehensive epidemiological data is still being gathered. More research is needed to fully understand the global incidence and prevalence of this condition. The signs and symptoms of bladder leiomyoma can vary depending on the size and location of the tumor. Common symptoms include urinary frequency, needing to urinate more often than usual, urgency, a sudden, compelling need to urinate, dysuria, painful urination, and hematuria, blood in the urine. In some cases, patients may experience lower abdominal pain or pressure. It's important to note that these symptoms can also be indicative of other bladder conditions, highlighting the need for a thorough diagnostic evaluation. Diagnosis of bladder leiomyoma typically involves a combination of clinical evaluation and imaging studies. A doctor will begin with a thorough medical history and physical exam. Imaging techniques such as cystoscopy, which involves inserting a thin, flexible tube with a camera into the bladder. Ultrasound, CT scans, and MRI scans can help visualize the tumor and assess its size and location. A biopsy, where a small tissue sample is taken and examined under a microscope, is usually performed to confirm the diagnosis and rule out malignancy. While bladder leiomyomas don't have distinct classifications in the same way as some other tumors, they can be categorized based on their location within the bladder wall, for example submucosal, intramural, or subserosal. Their size and growth pattern are also important considerations when determining the best course of treatment. Treatment options for bladder leiomyoma depend on the size, location, and symptoms the tumor is causing. Small asymptomatic tumors may be monitored with regular check-ups and imaging. Larger symptomatic tumors often require surgical removal. This can be done through transurethral resection, where the tumor is removed through the urethra using specialized instruments, or through open surgery, where an incision is made in the abdomen to access the bladder. In some cases, minimally invasive techniques like laparoscopic or robotic surgery may be used. Medication is not typically used for bladder leiomyoma treatment, as it primarily targets the physical mass. Unfortunately, there's no known way to definitively prevent bladder leiomyomas. However, maintaining a healthy lifestyle, avoiding bladder irritants like smoking and excessive caffeine, and promptly addressing any bladder infections or irritations may contribute to overall bladder health. Regular checkups with a healthcare professional can also help detect any abnormalities early on. The prognosis for bladder leiomyoma is generally very good, as these tumors are benign and rarely become cancerous. Surgical removal is usually curative, with a low risk of recurrence. Recent research focuses on improving minimally invasive surgical techniques to reduce recovery time and improve patient outcomes. Further studies are also investigating the potential role of hormonal factors in tumor development, which could lead to new targeted therapies in the future. While bladder leiomyoma can cause uncomfortable symptoms, effective treatment options are available to help patients regain their quality of life.